All right. And I'm going to start with as chairman of the Board of Selectmen for the town of Newton, New Hampshire. I find due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. Please note that there is no physical location to observe or listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I am confirming that we are utilizing Zoom conferencing software for this electronic meeting. All members of the board have the ability to communicate during this meeting through the platform, and the public has access to contemporaneously listen and, if necessary, participate in the meeting through dialing the following phone number 929-205-6099. Meeting ID number is 869-075-36632, or using the link previously provided in the agenda. We gave notice to the public of the necessary information for accessing the meeting, including how to access the conference call via phone. If anyone has a problem, please email bossecretary@newtonnh.net. In the event the public is unable to access the meeting will be adjourned and rescheduled. Please note that all votes that are taken during this meeting shall be done by roll call vote. So with that, I'm going to turn it over to Trish. As always, please give us an update on what you have. Thank you.
Okay, this is going to be a short one. I think I only have 5 bullets, really. I know that'll break everyone's heart. So, confirmed cases. We have 5,782. That's up 211 since we last spoke on last Wednesday. The recovered are 4,463. That's up 147 from last Wednesday. And unfortunately, 371 deaths. That's up 28 from last Wednesday. Friday, as you know, the governor issued Executive Order 2214, the 5th extension of the state of emergency, which brings us to July 15th. They reminded us, the Department of Health, they're still working on PPEs and distribution, realizing that many towns are trying to get more in anticipation of their opening. We also have, from logistics, no significant changes for aviation or rail service. The Coast Bus Service has officially launched a new route as of today that has been in the works for about 18 months, but now they're operating at a full schedule. They wanted us to know Civil Air Patrol conducted traffic assignments over the weekends, and they're going to send out data in case we're interested in that. Reminding us to continue to track and calculate expenses. We've completed one Gopher grant. As you know, it was accepted. It was over, I think Diane probably has it, over 29,000 was accepted. That's grant number 1. We're now currently at the same time working on 2 more grants, the second cycle for Gopher and the FEMA grant. So they reminded us to continue to calculate and track expenses. Conversation, according to the Joint Information Command Center, is still talk about wearing masks and reopening, not only in New Hampshire, but in other states. They also focused on some race and law enforcement at rallies that are currently taking place. And then we actually had a question from another town that said, when the state of emergency is canceled, will all the protections that have been in place be lifted? And where can this person, this was an EMD in Wilmot, where can I find the reasoning for the state of emergency, question mark. That's kind of a weird thing, but whatever. And the answer was the state of emergency will probably continue for a while longer. The wording and reasoning can be found in the text of the actual state of emergency message. They suggested this person should read it. And then they said, on Emergency Order 12, it allows government meetings to take place virtually and will stay in place until the state of emergency expires. Will there be some kind of notice letting us know about it expiring? And they said, for now, town government meetings can meet in person, over the phone, or virtually, and they'll give us notice when this all has to go back to business as usual. And that's it.
Wow, thank you. just kind of jumping off of that last one, that I think is the most important development for all of us, because it means that meeting via Zoom, phone, or whatever, we can continue to do that at least for until July 15th. I do know that the planning board was discussing how they were going to do their public hearings. There was some email traffic. Is anybody from the planning board on right now? No. So, question, Diane, I saw that Roger emailed you kind of about the technological aspect of doing this via Zoom. Do you have anything to share as to what they decided? I think what I'm looking for is, do we need to take steps to open up the town hall for the planning board, or are they not going to want that?
The last that I heard of, they were going to need the town hall. Now, unless that's changed.
That girl is a nightmare.
Why?
It's brutal.
Larry, whatever's brutal, put it on mute.
Sorry.
That was good. Larry is multitasking, folks. So go ahead,
So
Diane.
what we're going to do is tomorrow, Jamie and I and Jim are going to meet in the town hall and see how it goes, broadcasting it over channel 20.
Yeah.
Kind of do a dry run.
So when you're saying I'm sorry, not you, but when they're asking you to broadcast it over channel 20, are they just doing that so the people who aren't on Zoom can kind of listen in? That's not, because we had a couple of, when we met, by the way, the Monday, what was it? A week ago this Monday, we met on Monday morning in the parking lot to discuss planning board agenda items and how they could do a public hearing. And they were talking about a lot of different variants. So I'm wondering, does it sound like their latest variant is not to have any physical location?
I have not heard any update, so I'm assuming they still want a physical, but Kate probably knows that she has somebody right there.
Well,
Just
I'm trying to get him here, but I mean, at the time,
He might not even know, but
wait, at the time, the order had not been extended. So I
Yeah.
believe, at least from the person I know, that they're going to look into it. The concern, of course, is for the town of Newton guidelines to access town hall, that should be applicable for everybody, like boards, planning boards. And there was some confusion around that. And like if you're going to attend a planning board meeting, just they have a lot of paperwork. So we'll find out. I'm not sure what their position is, but as selectmen, I think it's really important we have the guidelines consistent through all meetings, particularly mandatory mask unless you have a medical condition. I don't know if planning board is clear on that.
yeah, I mean, I think they're pretty clear on that stuff. I guess the thing is, if they want us to take a vote to open it up to them on a limited basis, whatever it is, 30%, we kind of have to do that tonight.
Well, we need a planning board person. I know 18 people, I think, is the max that can fit with the distancing. Is that right, Trish? Does anyone know?
No, actually, Larry and I measured it all out, and we can get 20 members of the public plus the committee. And that's, I think, Larry, jump in. Was it, did we say that was 30% or 40%? I forget now, capacity.
So the capacity is 49. And if you do the 26 or 7, we'll be at like 52, 53%. But Jim did send out an email to me and Trish saying that he wanted to reconfigure the hall and put the committee lengthwise underneath the projector. So I don't know what the planning board's ideas are anymore.
All right, so I guess what it comes down to is we can't help them tonight. If they need us to vote on something, we can't do it. So
Well, I'll just wait till after the 15th, and they'll hold their third meeting or whatever it is live. Then if it's getting lifted.
Yeah. All righty. So that was kind of my main question. Anybody have anything else COVID-19 related?
Matt,
Diane?
just so Trish alluded to it, if you wanted the number for the how much we got back on that gopher,
Yeah, right.
it's $29,926.46.
Yeah. So excellent job from the EMD folks and all the department heads who had to feed them information. So that is that's pretty good. That's going to help us out a lot.
Yep,
So,
it will.
so good job. All right. Anything else COVID-19 related?
What about the task force? Do you want that or later?
So probably now. I think
Okay.
so.
Okay. So update on the task force. Yesterday, we were going to meet. We didn't. We really had, although I was silly in this, but we had really nothing that we could, nothing has changed since last week. We're in a waiting period until next week probably. However, I wasn't thinking about newspaper deadlines, and we really should have the selectmen look at the guidelines to see if we can approve them and meet tomorrow's deadline for the newspaper. If we can't, it'll have to wait till next week. I just thought it would be great if it would come out in next week's paper, because opening on July 13th would be that following Monday. But that being said, the action items left for, I want to say, unfinished business for the task force is, do you remember last Wednesday night we were talking about the logs? And then I think Matt, you and I maybe discussed a little bit on Friday. Tina had weighed in and reached Larry and I and was concerned about, the public seeing it. And what you and I, Matt, talked about that I wanted to toss out there so that the selectmen could see if this would work. There are some places that instead of a log where people are signing in, which, as Matt mentioned, he was a little bit concerned about HEPA if they're signing. We actually do have a way to have a log with every person that calls in for an appointment. So that staff member, and Mary Jo is already asking these questions, so she already has the appointment in her whatever daytime or whatever. She can ask the screening questions. So now we do have a way, CDC and Primex wants us to be able to have a way to contact trace. So if we just leave it, instead of a log where people are signing in, the staff people asking the questions for the appointment are actually jotting it down next to their name, no temperature, no signs or whatever we want to call that, for the log. And now we have a log, and just in case somebody does come down with something, we'll know who was in town hall at the time. It removes putting somebody out in the hallway or at the library. I don't know, the library, Terry, you're a whole nother entity, but at least for town hall, people are coming in via appointment only, and that could be our contract tracing log. And yet, like you said, Matt, you didn't want something where people were seeing who was coming in and who had a temperature before them or anything else, which was Tina's concern as well. So I wanted to toss that out to the selectmen to see what you think about that, because if you want something like that, and it would be great if you could make a decision, we can change our flyer. Instead of saying, you'll take your temperature at home to be recorded in the logbook at town hall and answer questions, we could change it to simply say, take your temperature at home and be prepared to answer screening questions when you make your appointment, something like that.
Yeah, I think for me, it's almost like it's not a log, it's a register, right?
Okay,
So,
we could call it something else, right?
So you're registering for your appointment, and we're just taking, as Trish said, the main goal with that is not to create a medical record, it's to create a means of contact tracing.
Correct.
So I think that's a pretty good idea, however we do that. And then, I mean, those questions are really mitigation, and it's really just awareness. It's almost like if I was on the phone with somebody making an appointment to come see Mary Jo, I don't know if I'd ask it of, you know, have you taken your temperature? What's your temperature? Are you feeling achy? Are you feeling dry cough? It's almost like you want to say, you know, if you have the ability to take your temperature, please do so. Please also, if you feel sick, do not come in. We'll reschedule your appointment. If you remember symptoms such as this, whatever they are,
Yep.
are symptomatic of COVID-19. And what we're doing is we're trying to take mitigation steps to protect our staff. So it's almost like you're not asking the questions, you're just another threshold of a notice requirement,
Right.
I guess is what I'm saying.
You could almost do it, I think you may have mentioned that, or somebody on, I don't know if it's Board of Selectmen or the task force, mentioned that we could do something like that as outside the front door and have it laminated, reminding people, just a reminder, if you have any of these symptoms, you know, please go home and call to reschedule or something like that.
Yeah, yeah. What's everybody think?
Well, I do think the questions, do you have any of these COVID symptoms? 1, 2, 3, 4, 5, and then
Yep.
just one yes or no. We
Mhm.
have to itemize what those symptoms are that we're asking for.
And
But
that's a
don't have
good,
to ask each one individually.
yep,
That's what the
And-
hospital does when I visit my mother.
exactly.
But that's true, Lisa, but the only thing, be careful with that, is those are HIPAA people asking those questions. So that's why I say it's not so much we're asking questions where those symptoms you just talked about, Lisa, we're listing those, saying, you know, please be advised, these are symptoms of COVID-19, you know. So what are people thinking? I mean, my main thing, like I just said, is let's not make it a questionnaire as much as it is a notice.
Well, people can
Well-
refuse to answer the question if they're concerned about HIPAA and then not have a face-to-face appointment.
I would agree with that.
True,
Most of the
however,
questions,
however, down the road, what happens?
Wait.
Can I-
Trish, or who's about to say something?
No,
Tina.
not me.
Larry,
Tina, sorry.
Larry.
I kind of agree with Matt. I don't think we need to, you know, say yes or no to each individual symptom, because if anyone is exhibiting any one of the symptoms, you don't want them in there.
Yeah, that's what I was saying.
Yeah.
Say, do you have any of these symptoms? Name them off, and then it's one yes or no.
Oh, I'm sorry. I thought you were asking them to record for each symptom.
Oh, no. One yes.
Yeah, got it.
Larry, were you going to say something?
yeah, the main questions they ask, if you had a fever, have you done any traveling, have you been around anybody with COVID-19, and do you have any symptoms? Those are the basic questions that most, I want to say, appointments, whether it's you get your hair cut or the dentist or doctor's office, those are the questions they really ask. But
Yeah, and I think what I'm finding is, you're absolutely right, Larry, but what I'm finding is when I go to the places that are not HIPAA certified, like the doctor's office, the dentist, whatever, they don't ask questions. They give me a notice that we don't want you to come in if you have these symptoms.
correct.
And that's what our people are. Our people aren't in a position. What I'm afraid of, and I'm being too lawyerly with this, is I'm afraid of what happens down the road when we have somebody, because we'll have somebody who said we denied them their right to enter the town hall to take care of business because we gave them a medical screening, which our people aren't trained to do, and they failed the medical screening and we kicked them out. So
So why don't we just go with, have you done any traveling? Have you been around with anyone who has COVID-19? And do you have a temperature? Just those 3 questions. Because people are going to lie anyway.
yeah, exactly. But and
True.
that's why I think we're going in a circle. But all of these symptoms or travel things are good. Like, I don't want to get rid of any of these. I just don't want to phrase them in the form of a question. I want to put them as a notice. And that's it.
So you can't say, are you
So you
currently-"
can write.
That-
So you can write it up as, if you've been around with anyone with COVID-19 or have traveled recently, please advise staff or whatever. Then, however you want to word it, but you can leave out the medical part if you want.
Yeah,
Why
it's,
can't you say, are you exhibiting any symptoms of COVID-19? And then you have a list, and if they don't know what they are, you can read them to them. I mean, I think
Yeah.
that's
Matt,
reasonable right now.
somebody, was that
Yeah.
Charlie?
that's me. I'm trying to jump in.
Go for it.
Okay, I'll tell you what they do at the State House.
Okay.
Not at the State House, at the Whittemore Center, where there's
Yep.
going to be over 400 people meeting. What they
Right.
do is the first thing you pull into the parking lot, they take your temperature, and then they ask you the 4 questions. And if your temperature is over, they're not going to believe what you say for answers, because everybody's going to lie, just like Larry said. They're
Right.
going to want to get in, they'll lie. But if we have 2 people in the town hall like we do, we have Mary Jo and we have Cheryl, one of them can take the temperature and ask them 4 questions. And that's all we need to do. And if their temperature's too high, we tell them, really, you can't come in now.
But that's when
And
we're
we've
making
got-
a medical diagnosis, is when we're judging their
No,
condition
there's a-
based on their temperature.
Well,
Well,
there's a
schools do
temperature
that.
setting. Ask the fire chief, he'll tell you there's a temperature that's where you have to shut them down. I think it's 100.4 or 100.7. 100.4.
100.4.
Yeah, they do that at
Yeah.
hairdressers, at schools.
Yep.
I mean, it's
Yep.
not,
And
So-
Primex is recommending that, as well as
so I
CDC.
think we need to do it. That's a good example to set. We don't want to get the people in town hall sick. It's to everyone's benefit who goes in there.
I would, but here's the way I look at that is, now the people at town hall have to come closer to somebody to take their temperature.
Yeah, how do we do that? We've got to figure that out.
So that's why
How do we do it?
I would.
Yeah,
They
and
wear
they have
masks and
those
they wear
nice,
gloves.
expensive, no touch
Nope.
thermometers
Yeah,
that they
we
just
have those.
hold up close to the forehead.
Yeah, you don't have to go close. You just go like,
You don't have to go close, yeah.
Well, right,
Right.
but why'd we get them the shields? So now they're coming out from behind the shields. So the whole reason that we had a partition up there, now they have to come out.
Unless you do the questions ahead of time when the appointments are being made, because let's face it, let's say I want to register my car and I am, I don't know, not a computer person, so I can't do it online, so I want to come in. I call to make an appointment. Mary Jo or Cheryl ask me that, have I traveled? Have I been anywhere, anyone with COVID? Do I have any COVID symptoms? Okay, your appointment's next week, so now it's a week later. So who cares if I got a temperature
Okay.
today? You can say, do you have a temperature? And the person can lie on the phone. Then they come in for the appointment, and on the other side of the screening that we are putting up, they can aim the thing at their forehead, and now if they've got a temperature, they got to leave. Of course, now they've already been in town hall, but we can do the questions ahead of time and then double check the questions, or not the questions, but the temperature the day they actually arrive.
Yeah, that's another thing you just mentioned about town hall, because it's so small. We don't have a gating process like Charlie just described at the Whittemore Center.
Mhm.
But so let me just cut to the chase here, because we're kind of saying the same thing over and over again. What does it currently say on the paperwork, Trish, as far as that we were going to advertise?
Okay. Oh, and I should update you on that. I think I called you, Matt, and told you after legal called me. So the paperwork said, let me read what you guys approved, accepting we had to check into no children allowed. by legal, and I've got that answer for you. So we said, you shall have an appointment with the office you need assistance from. Mandatory masks unless you have a medical condition preventing you from wearing one. You shall take your temperature at home to be recorded in the logbook at Town Hall. You shall answer the questions and sign the log attesting to normal temperature and no COVID symptoms. And then this is mandatory, is underlined. You shall adhere to 6-foot social distancing rule. You shall use hand sanitizer upon entering and leaving. Only one person will be allowed in the building at a time unless required by staff. Whenever possible, please leave children at home. If you will be signing documents, actually, I thought we had one that said no children. Oh, okay. If you will be signing documents, bring your own pen. During committee meetings, once maximum capacity is reached, no further access will be allowed. Residents will be encouraged to participate via Zoom. So legal said, and I guess I printed out the wrong one. Our old one said, no children. I guess I don't have that in front of me. I didn't print out that one, I'm sorry. But what legal said, and I got calls from State Legal Counsel, NHMA, and the Attorney General's office. They all said, take that sentence out that said no children allowed, and then instead put, whenever possible, leave children at home. The NHMA also suggested, just in case we do have, say, a father's working, the mother's alone with the kids, and they got to register or whatever. And so she has no choice but to bring the children in. He said, we should have a couple of chairs in a designated spot that is like for children. And the parents should be told by the staff who they have the appointment with, please have your children seated in the designated area. And the AG and NH said it was to prevent them from walking all around, and then of course cleaning everything they touch. So a designated area for children, or if somebody had to bring a guest, they sit down, they don't walk around, they don't touch things. And
Put 'em in
that
Diane's office, maybe we could.
yeah, there you go.
Yeah,
We could have
we could put a little cage.
a little
Build a little
cage.
cage and lock them in.
Right, right. So that's what legal said about the children piece. So unfortunately, I didn't bring that one that said no children allowed, and I put what they suggested is, whenever possible, please leave children at home. So that's what we've got for guidelines. So if you guys can't come up with something today and we have to wait till next week, it just won't make the paper in time. And that it is what it is. I'm not going to fret over it.
Well, that might even be a softer opening, right? So,
Yep.
But I propose it to the board. So Trish just read to you what we last agreed upon. Does anybody want to change anything off of that? And if you do, can we do it in a form of a motion?
So
I don't
I'll
wanna
make the
change.
motion. I'll make the motion to accept the guidelines as written with the change of, if possible, leave the children at home. And again, this document is going to be tweaked within the next 6 to 7 months. So it's an ongoing document that's going to be changed. So we have to adopt something to start so we can open. So I think
I'll
this is a
second.
good start. It's a good list.
All right,
Yeah,
so
that's
is
my
this motion just to accept the amendments proposed by Tricia?
No, the whole list with the change of the kids.
So in a sense, Lisa, yes. So the only change would be the kid part then, Larry. Because it's
Correct.
kind of it's already been approved other than that, right?
No, you have not approved the guidelines.
Really? Okay.
No, you
So-
did not.
So I stand corrected. So ignore everything I said. What Larry just said holds true. And
So
I
you're
think
gonna move to
Charlie's
accept-
second.
So move to accept the
Yep.
guidelines as written.
Correct.
What she just read, which has the amendment to the children.
Correct.
Correct. Yeah.
Correct.
I don't
That's
know.
the motion.
Second.
All right.
And I second that.
So Charlie seconded and Kate was a second. So that's good. So why don't I don't think we need any more discussion, right? So let's do a roll call vote. Lisa, how do you vote?
Aye.
Kate,
Aye.
Charlie,
Aye.
Larry,
Aye.
and Matt's going to be an aye, but I think we're going to be changing this a lot. But this kind of just gets us seaworthy, so to speak, and gets us out in the water, and we'll see. If we start taking on water, then we need to start plugging
That's
some
the
holes.
whole.
All right. Anything else from the task force we haven't given them that they need?
Yeah, so we need the opening date. Is it going to be July 13th?
Well, Trish knows how I feel about the number 13. Is
Well, the 13th on a Monday, so if you want to go with that Sunday, July 12th, that's fine too.
yeah, I think that makes sense to go with the 13th. I mean, that's the first full, well, not full week, but that gives us time.
Can we
And,
discuss
Cheryl-
these? Sorry.
Cheryl, Mary Jo are 110% back in that opening July 13th, and that was this morning that they
Right.
want to open. They need to move forward, and I was in there this morning. I think Charlie was in like 2 hours after me, and they told him the same thing.
Yep,
Okay.
they want to open up.
Okay, Lisa, you were going to say something?
Yeah, the COVID screening log that was proposed. I just wanted to discuss that for a moment. Before we use that one, I'd rather, instead of having these individual symptoms, just any COVID symptoms, yes or no, and then just have the list of symptoms posted by the offices that they would be visiting.
So is that a motion?
It is.
Okay.
I move to
I'm-
accept the COVID screening log with that change.
Second, I'm good with that.
Okay, Larry, and any discussion? So Matt's going to be a nay because of what I talked about earlier, that I don't think we should be recording any of this information. I think we should just have a register for contact tracing. So
Yeah, but you already said yay to the guidelines, which says you shall answer the questions and sign the logbook.
I know, because I said I wanted to get the boat out into the water, but now that we're specific to the log, I'm going to say nay. So let's go around the horn here. Kate, how do you vote? You're on mute, so give us a signal of something.
Aye, it goes well with what we just approved.
Okay, so, and Lisa,
Aye.
Larry,
Aye.
Charlie?
I'm going with you, Matt.
Okay, so Charlie and I are nays simply for the, like I said, I'd rather see a
Second
register.
part.
Okay, but that moves us along here, I think.
And I mean, if,
Again, that's a document we can tweak after the first week. If we know it's not working out, we can change it, but it's something to start up with.
Yep, true,
Yeah, it's a living document, just like every other document the board has.
true. Kate, you were gonna say
to
something?
say that we'll see, things change quickly these days.
They do,
Executive
they
order
do.
could get extended. We just don't know.
They
Can
do,
I ask
so-
a question?
go ahead.
So, kind of coupling on what Lisa said, and looking at the guidelines, and of course you just approved the guidelines, but so this is a question. On the part that says you shall answer the question and sign the logbook attesting to any COVID systems, as Lisa mentioned, should we take out and sign the logbook so that we're in, or the register, whatever we're gonna call this?
Actually, I think you're right there, Trish. I
Yeah,
don't think they don't need to sign it because we're actually the ones documenting it.
right.
Yeah, no. So, I mean, is everybody
So I move to
friendly amendment?
amend the guidelines to remove the and sign the logbook attesting to.
Okay,
All right, everybody still seconds and yays and nays?
Yes.
Okay,
Yeah.
so we'll,
Kate, you're
Well-
on mute again.
Do we need to put something where we let them know that that person, they're gonna at least, it's gonna be written down somewhere by someone?
Whoever's doing the appointment.
Yeah, like, do they need, should we put that in the access to town? Like, shouldn't we let them know that? How it's gonna happen so they know what to expect? So it says, you'll take your temperature to home. No to be recorded in the logbook at town hall. And like, usual answer the questions and sign the logbook attesting to normal temperature, no symptoms. So we
They're not signing.
We're not signing.
Right. But I mean, if we just approve this,
Yeah.
to get the wording correct, that's
Yeah.
all.
You're talking about notice, so they know it
Yeah, so they need to,
was, yeah,
to know what to expect, otherwise it's
Yeah.
gonna be, that's all I'm talking about.
yeah, that's all,
Emailed you the guidelines, everyone, the older one that still had no kids.
I mean, I
need
think it should
to-
state in the guidelines that, you know, you're gonna call and you're gonna talk to somebody on the staff and they're gonna log this information.
Right.
Yeah, that's not there yet.
So,
Okay.
so if it's not there yet, are you okay with that friendly amendment, Lisa?
Yes.
Cool. So, all right, I'm gonna just call for an old fashioned, everybody in favor say yay.
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 Every- Not in favor say nay. Nay.
Are you an A?
I'm a nay, yeah. Just in general concept terms.
I thought you just made this motion. Okay.
I didn't make this motion, that was Lisa.
Oh, that one, okay.
Okay, you've got that, Diane? That was, we're all
No.
over the map on that one.
I
No?
have no, I don't even know who seconded at this point.
So we're good. We usually get you back.
Technically, Kate made the motion and I accepted or Kate made the friendly amendment and I accepted it. So that would make her the motioner and me the seconder.
So can you read, Diane, the original motion, how you have it?
The only thing I have, because I couldn't figure out what Kay was saying, was Lisa, amend the guidelines to remove sign logbook.
So,
Right.
Let's-
And okay, so after COVID-19, add which will be recorded in an internal log. How's that?
By phone or something. At some point, again, we have to be very clear in the guidelines that people see, like when
But
can
that-
we send that?
We are letting them know that we are recording the information that they give us. I don't want to have to say that they're giving it to us on the phone or they're giving it to us in person or whatever, because it could be either or. I just want to say you shall answer the questions attesting to normal temperature and no symptoms of COVID-19, which will be recorded in an internal log.
I think, okay, that's good.
all right, so Lisa made that motion. Diane, you got that?
Yeah.
We're gonna clean this up. And Kate seconded. So now we're gonna do our roll call. So Larry, how do you vote?
Aye.
Charlie?
I'm confused.
Yeah. So basically, it's the motion we talked about, just cleaned up. So there is still a log. The log is filled out by the person in the office who's taking the appointment, and they're asking the questions and they're writing down the responses to the question.
Right, and this motion, Charlie, is regarding the guidelines. It is the fourth bullet of the guidelines. We are modifying that fourth bullet, taking out and sign the logbook, or taking out sign the logbook and adding which will be recorded in an internal log so that anyone who is looking at this will know what we're doing and why.
Okay, I don't have a problem with that.
So you're a yay?
I'm a yay.
Okay, Kate is on mute, but she looks like she's a yay. And
Yay.
Lisa, you're a yay, right?
I am.
Okay, Matt's a nay. So, all right. Anything else for the guidelines? No?
Other than they should be uniform throughout town hall, in my opinion. I mean,
Well, yeah, that's why we
Right.
voted on the
I
guidelines.
understand there's been some confusion at, other committee meetings about guidelines, and that just, we make it clear that this is uniform for any entry into town hall.
Yeah, but here's the way I see it is, and correct me if I'm wrong, no residents can enter town hall right now unless they're going to see the town clerk and they're following this process.
I'm just,
Everybody's nodding. There's no other residents that should be entering town hall. Now, we're all residents, right? But I mean, there might be staff members, but no residents for anything else
Except for the food pantry.
except for the
public.
food pantry, which predates all of this.
and potential planning board
Mhm.
meetings, et cetera, which
That
last
is,
we heard is going to happen, and they need to know if the public comes, what the rules are.
And
right, but you're
Nobody-
talking
what about the planning board
Matt,
administrative
nobody's
assistant
allowed
office?
downstairs. Nobody
But-
should be allowed downstairs.
right. But here's the thing, Kate, is the planning board hasn't asked us to lift any restrictions. So they cannot, if they want to meet Tuesday in there, they can't do it.
Okay, good to know.
So if they want to, they should have come tonight, but oh well.
Yeah. When is planning board administrative office going to be open? Is that not part of the first soft opening?
I don't believe so.
I think he's been working. I think
He's been
Mondays
working.
and
Well,
Thursdays.
I know he's working, but I mean, when will the planning board administrative office be open to the public, is what I'm saying, for
Oh.
appointments?
That's not supposed to be for a while.
That's-
Future.
Okay, so it's not part of the initial soft phase. That's what I was clearing up.
So Diane is smiling and waving. So Diane, what do you have?
I believe Jim has been meeting with people.
Exactly. You should
By
not be.
appointment.
And he should not.
Inside?
In his office?
I believe outside.
Yeah, outside,
Okay,
That's
He has met with people outside.
right.
Yeah. that's cool.
That's fine.
yep, that's not in town hall, so that's different.
So technically he is open.
Yeah, right. But
So,
All
Matt, question.
Larry,
So this is a soft match for town clerk and all that. What's the schedule for Diane's office, the planning board's office, Nancy's office?
so
Do
I
we have
think
a
that
schedule?
I don't think we have a firm one. I think that's up to us. I think we had talked a little bit about like the phased approach in that July 13th, we open this up, we see how this works.
Exactly.
And
Yeah,
Mhm.
we learn from this and,
right.
but I think we're responding with this, we're responding to the biggest need, So I guess July 13th they'll open, and sometime around July 20th, we'll start to talk about what's working and what's not, right?
And the next phase.
And,
Okay.
and a rough plan. All right, anything else for the July? So I don't think we made this motion, so I'll do it. I move to schedule the, I'll call it the phase 1 opening of the town clerk's office under the guidelines for July 13th.
Second,
Is that pending the plexiglass going in? What if he gets delayed?
I don't know. This is news, so.
Okay.
What's-
No, I'm just asking because
He
he's
says
coming
he's
in
on
on the
schedule.
9th. Okay,
Yeah.
okay.
Yeah.
All right.
So let's go around the horn. Kate, how do you vote?
you're on
You're on
mute,
mute.
Kate.
Can I just ask you something else? I had a memo saying that the order expires July 17th, but it's actually the 13th. Is that correct?
15th.
The 15th. Okay, so much for that email I got. Okay, and your motion is for the 15th, correct?
13th.
13th.
So before the order expires to do the soft open.
Right, so the order, you got to understand what the order is. The order really has nothing to do with what we're
Yeah, just
talking
a
about.
process. Okay,
Yeah.
I'll be an aye.
Okay, Lisa,
Aye.
Larry,
Aye.
Charlie,
Aye.
and Matt's and I. So that date works. If for some reason something's, breaking, not working, whatever, come back and see us, I guess, but we're good with that. Anything else COVID-19 related?
I have one more request of Nancy. And I don't know if this has already been done. I sent a text to Tony, but I really should have called him. Could you see if he can take one of those sanitizer stations and set it up in the Butler building for Mike?
Sure, yep,
Okay, thank you.
yep. And I did talk to him about maybe a little more cleaning each day once the opening takes place, and he said yes.
Okay,
So I'm thinking it would be later in the day or earlier in the morning before they open.
okay, perfect, thank you.
All right, if there's nothing else COVID-19 related, I want to hit upon a housekeeping task the board has to do. Okay, so the board last night made a motion regarding some employee payroll concerns, and we didn't put a effective date. So Lisa, did you have a motion you wanted to share with us?
Yeah, I'll make a motion. I move to approve the paramedic incentive approved at the 6:30 non-public session be paid retroactive to March 1, 2020, and the EMTB incentives approved at the same meeting be paid retroactive to January 1, 2020, when supporting documentation is submitted to the town administrator.
All right, is there a second? Seconded by Larry. Any discussion? Let's go around. Kate, how do you vote?
Aye.
Larry,
Aye.
Charlie,
Aye.
Lisa,
Aye.
Matt's and I. So that's that one. Okay, was there anything else on the agenda, Diane?
Unfortunately, there is a little problem. Well, it's actually a big leak at the old fire station. And
Yep.
I did get a quote for $750 to have it fixed.
Yep.
So I didn't know if maybe what you guys want to do with that.
Yeah, I saw that, Diane. So I would like to make a motion to authorize roof repairs not to exceed $750 for the old fire station.
Second.
Second.
Seconded by Kate. Don't think there's any discussion. Let's go around. Larry,
Aye.
Charlie,
Aye.
Kate,
Aye.
Lisa,
Aye.
Matt's and I. So plug that hole.
I guess it's a big long hole.
Oh, really? Well,
Yeah. So he was kind of funny. He says he didn't he'd never seen any kind of roof like that before.
yeah, it's a classic. All right. Anything else for this meeting tonight?
I have
The
one
minutes.
question.
June 24th minutes.
Okay, Nancy, go ahead.
I sent out an email to the board today from the DOT regarding Rose Corner project. They're looking to have a meeting with the public, whether it be Zoom or in-person meeting. I heard from Lisa, she's fine with the Zoom, but I haven't heard from anybody else. And they
I'm
need
fine.
to, they
I'm good.
need to,
Zoom.
Zoom, okay.
Me. I vote Zoom.
What about Charlie and Larry?
Whatever's easier, it doesn't matter.
Well, I'm thinking at this point, Zoom is probably the better way to go. We could probably book it sooner rather than later because they need to get some answers before they can move forward.
Yeah, and I'm sure the public would be happy to see it sooner rather than later too, because they keep asking about it.
Okay. So Charlie,
Yeah.
are you in favor of the Zoom?
Oh, definitely.
Okay.
I'll do whatever I can. I want that intersection done.
All right, I'll contact them tomorrow. Do you have a preference on dates? He hasn't given me any, but if you recommend some, then maybe he can go with that. I don't know.
Not the fourth Wednesday of the month.
Okay,
Yeah, I think it's going to be kind of a
hit or
roll
miss.
of the dice. Yeah, roll of the dice, but Tuesdays are not good, right? We know that. Wednesdays are usually school boards, so those probably wouldn't be good. So
Monday, maybe?
perhaps Monday,
I'll,
perhaps Thursday. I don't know if Saturday morning would be any, interest to the public. I mean, it's all about the public, really.
yeah,
So whatever the public would be more apt to participate. But Zoom, you can do it in the comfort of your child's nursery. So
right.
you can certainly do that.
All right, I'll check with him and get some dates and then run it by the board and see which one you want to do.
All righty.
Thank
So Diane, you had minutes from the 24th. That was just public.
Correct.
I
Anybody want?
move to approve the minutes from June 24.
Is there a second?
Second.
All right, Kate was the second. We'll go around. Larry, how do you vote?
Aye.
Charlie,
Aye.
Kate,
Aye.
Lisa,
Aye.
Matt's an aye. So that one's done. Anybody want to make a motion to adjourn?
Aye.
So move.
All right, so that's non-debatable. We'll be back in one of these meetings next Wednesday night. But everybody have a good 4th of July weekend. And we're hearing it from just about everybody now. Keep up with the masks. Our numbers in New Hampshire are unbelievably good. Let's keep them good. So the governor, Dr. Chan, Dr. Fauci, everybody says social distance, use a mask if you can't social distance. So, all right, have a good night, everybody.
Yep, and thanks, everyone.
Night.
Good night.